prone position. This helps because it releases the gastroc soleus complex and allows the patient's foot to fall into 90 degrees with gravity, but also so that you can push it there and guide it there without so much resistance and pain. You start with a 3-inch roll, and it is cold to lukewarm water. It is not hot water because it is an exothermic reaction. If you use hot water, as it heats, it will burn the patient's skin. The first roll is just laid on. Bubbles are fine. And it solely locks in the ankle. It is not to go really above the ankle. We'll then go to a 4-inch. Our assistant is going to hold the foot into a better position than negative 15 degrees by pushing gently on the foot, like this, okay? As we start to roll our 4-inch up the leg. Using a 4-inch on the leg is much easier than a 3. Than it would be, I should say, on the foot. If you use a 4 on the foot, you get more bubbles, and it's much harder to mold because it's a smaller, narrower structure. You go up to 2 fingers breadth below the tibial tuberosity. And as you see, I do have some bubbles in here, which is fine. We'll correct those with our final roll, which you do lay on tight to get rid of all bubbles and imperfections. One of my rules of casting is the patient doesn't know what you did inside if you did surgery. They see what you did on the outside. If the outside looks displeasing, then they're going to assume the inside also looks displeasing or was done poorly. You should see all 5 toes when you reveal them and cast. Ideally, this would have cut across the ball of the foot a little bit more, but it is more than fine at this rate, at this level. I put soap in my final roll because that allows the fiberglass to stick to itself and work as a lubrication so that it doesn't stick to everything else. And this roll, of course, you'll roll on tightly, and it should cover the entire leg. It should pull out any bubbles or dimples in the casting. This patient didn't quite get to 90 degrees due to pain. But the cast is essentially complete. There's no imperfections, bubbles, and she now can turn over, and she's ready to leave the office.